Good evening. My name is Olivia K. I'm known as Olivia K on Facebook, Ollie K on Instagram, and WarmEM 9800 on Reddit. I cover nursing related topics, NCLEX related materials to help a nursing student who's going to prepare for their first or second or third attempt. I try to give NCLEX tips or helpful tips to help even nursing students. I also cover reality TV shows because, like I said, and I say in every video, nursing can be a lot. You nursing students can relate. So you just kind of want to decompress. So I go over those if you get tired of my nursing related stuff. I do have a whole playlist of Love is Blind from 1 to 10. Then I have some reality TV shows such as like Age of Attraction and Temptation Island. I'm going to watch season 2 and try to get a video out this weekend. And I watched a Michael Jackson movie, so if you're interested in my review, it's up as well. And I'm going to probably cover the Lamar documentary, I think Thursday night, because I did I sorry, I did watch it, and it's groundbreaking. I think it's important to go over. So it'll be an interesting thing to talk about, I feel. And I'm probably going to think of other nursing ideas. I think I want to do some topics to help like students that will be taking the TEAS or something. My math's not my strong suit, so I'm not sure, but there, like, if you need extra help on that, there is like a playlist of TEAS videos, and they're kind of old, but you can still watch and be able to get some ideas as well. Okay, so tonight I'm going to cover cardiac arrhythmias. Very important for the NCLEX. When I took the exam like a month ago, I got a bunch of not a bunch, I got like 2 or 3 arrhythmia questions, and I'm, like I said, I'm pretty sure I got them correct because hell I passed. So the thing to keep in mind with arrhythmias, you need to understand the normal cardiac normal sinus rhythm, and compared to any other arrhythmias you may see that is not stable, and what to prioritize basically. So I will leave some links in case, again, if I don't explain it properly. There's some links you can look at. MRK does do an excellent lecture on it, but again, you'd have to buy the bundle, and he does a very damn good job, because without him I wouldn't have been able to do so well in the arrhythmias. Okay, so I'm going to start with the ones you should be aware of, the arrhythmias everyone should be aware of. So I just mentioned the normal sinus rhythm. Rate is 60 to 100 beats per minute. It's regular, and there's a P wave that's present before the QRS. Like, you can see in mostly medical shows, you can tell it's normal. And actually, I will provide a picture of like the different arrhythmias, so that way it makes sense to you as well. Then you have AFib, and before I even get to VFib as well, so I will mention this in a second, but AFib is chaotic, irregular, no P waves are present. So before I get into VFib, so what Mark K explained to me is that when you're seeing fibrillation in a question, just know it's chaotic. That's what it's going to look like. Okay? The VFib, chaotic, irregular, and this can result in death within minutes. So it's one of those arrhythmias you'll have to act fast on, and I believe I do go over the deadly ones you need to pay attention to. VTAC, wide, bizarre, QRS. So that's bizarre, and it's very deadly. So they're gonna look like tombstones, or I like to also say they look like valleys, like, like little mini mountains. They can be dangerous, right? So that's how I kind of also equate the interpretation as asystole, flatline, no pulse, no electrical activity, act now. But before I get into that, you see them all in a lot of medical shows like Grey's Anatomy. And, Grey's Anatomy is not always accurate, rarely, or The Pit. you'll see a cardiac monitor and then it's flatline. So I will tell you the interventions you need to do when dealing with systole. Then sinus bradycardia, rate, well, you know what bradycardia is, less than 60. So rate is less than 60. P waves are present before the QRS complex. The sinus tachycardia, again, you know what tachycardia is, rate over 100. P waves are present before the QRS. Then the infamous A flutter, because I used to confuse fibrillation and A flutter. So let me tell you how you're going to tell the difference between the two. With A flutter, sawtooth. Like you can tell, like it goes do 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 do, right? It looks like a sawtooth, okay? Then AFib, chaotic, okay? It's irregular. SVT, the rate is 150 to 220. It's common. Then PVC, premature, wide, and bizarre QRS with pulse complexes. So those are the ones you should be aware of, especially the like I said, the first 5 ones. Well, the first 6. So AFib, normal sinus rhythm, that's a given. AFib, VFib, VTAC, systole, and A flutter, especially A flutter. That's the most common ones you kind of see in a cardiac telemetry unit. That's based on what I've heard from other people who work in that facility. Okay, so I'm going to go over the treatments. So normal saline, you should know you don't need to do anything for that. Intervention isn't needed unless they're symptomatic, and most of them wouldn't really have a symptom, but that's why you assess. Okay. AFib. So these are the ones. So going forth, as I'm about to talk, you need to start and underline everything I'm about to talk about. So you need to understand this, okay? So, which is why I'm going over all this. So I'm going to start off with AFib. You commonly can see these with hypertension, heart failure patients who take stimulants, okay? You may see AFib in those. So your treatments would be your anticoagulants, so which would be warfarin, or in other words, Coumadin, and Pixaban. I believe that should be Xarelto, if I'm not mistaken. I think that's Xarelto. Digoxin, and then your antihypertensives will be your dilitizum. Sorry, I'm bad with pronouncing generic, but that's what it's called. And that's tropolol. So those are usually treatments and go-to. Then sinus bradycardia. You commonly can see these with athletics, so with athletes. And I saw a question that on UWorld. So if you come across that question and they're saying this patient's an athlete, his heart rate's 48, and your choice should be no intervention, just assess, because they're normally asymptomatic, and that's how the body normally works. It's the body's in higher demand because of the less cardiac output. I don't know how to explain it, but you basically know what I mean. Then some meds can cause bradycardia. So no intervention will be needed for disabled patients. So again, disabled patients, there's nothing you need to do. Unstable, they will need either atropine, or with the elderly patients, depending, they can need what's called the long-term pacemaker, which I'm going to probably go over in a short, because those are important. They do ask about that as well. The sinus tachycardia, you can see that with exercise, anxiety, stress, sometimes fever, and if they take stimulants. So you want to treat the underlying cause. Okay. So SVT, so that's a supraventricular tachycardia, commonly seen with stimulants like maybe cocaine or something. Increased anxiety, electrolyte imbalance, definitely. So the first line, so this one, star on the line, vagal maneuver is going to be your first line treatment. And when I say that, the patient has to bear down like they're about to take a poop. Sorry, I'm trying not to swear. These videos are more, professional. So they have to try to bear down, okay? Then that doesn't work. They do what's called adenosine, rapid IV push. So I'm going to also go over the medications that cannot be administered IV push, because that's so important for you to learn also for the NCLEX as well. So the heart's going to briefly stop when they're given this, and that adenosine has to be given like within minutes. So teach your patient when that's happening, the heart will briefly stop, and not to worry, it's going to pump again. Okay. A flutter. So this is commonly seen with patients with heart disease, heart failure, COPD, electrode balances. So this would be like the same treatment as AFib. So for these next 3, actually I have a bonus. So next 4, please star triple underline. I don't care what you have to do in order to understand what I'm about to tell you. These 3 are your most deadliest and the most prioritized arrhythmias you need to pay attention to. Okay? So I'm going to start with VFib. VFib, chaotic. And it's like you're going to see it's chaotic, and it's going to be hard to really tell the QRS because it's like all mumbo jumbo, basically. So listen good with the pulse. So if this patient has a pulse, you're going to give amiodarone and lidocaine. So the way Mark explained it to me, you're going to take your first 2 fingers, the thumb and the index, and the way to remember is you put this under upside down. So notice that it's shaped like an A, right? Amiodarone. Then you know how when we were a kid, we used to put the L on our forehead, like, you're loser, loser, loser. So you can see here it's shaped like an L. So I know it's backwards here. Let me do it. So L, okay? So that's lidocaine. Mark K is the one who taught me that. So props to him. Okay, big ups to him. So if they're unstable, maybe you would do a cardioversion. All right. If they are not stable, VFib, DFib. This is what Mark also taught me too. VFib, DFib, and it's never left my mind ever since he said that. So big ups to Mark K. He really saved my life during the NCLEX studying. He's good. I have to do a video how I studied too for the NCLEX to see if I can help others. And again, it depends on everyone's needs. Everyone's needs is different. So DFib and then CPR. Okay, that's what you need to understand. So then the next one, VTAC. Remember what I said, how VTAC looks like tombstones? That's an easy way to remember. For me, they look like upside down mountains or valleys. And valleys and mountains can be dangerous. So that's another way I also remember it too. Now, again, if they have a pulse, the same thing as I said with the VFib. Amiodarone and lidocaine. Now, they don't have a pulse. What did I say again? DFib, CPR. Okay? Next, asystole, CPR. And then epinephrine, that's every 3 to 5 minutes. So before you do any of that, okay, I need you to listen. Assess the patients first. Because sometimes it depends with what the patient's doing and if they're stable. Sometimes you can look at the monitor and it'll look like that, and the patient could be very well okay. So you're not going to want to do CPR if they're fine. So if that happens, properly place the whatchamacallit, I can't even think of it, but you know what I'm talking about, the ones they stick on the chest, on the heart sounds. So just put them where they're supposed to be, and then of course monitor, check vitals, assess before you do any of these actions. Like I said, they have a pulse and they're unstable, you do the amiodarone, lidocaine, maybe conversion with VFib, like I said. As I said, there's no pulse, DFib, CPR. Asystole, CPR, epinephrine. Please do not delay the treatment if they are unstable, they're not responsive. And with asystole, No defib, no cardio version. CPR, epinephrine. Now, I have one more bonus one that I want to talk about, which I've been saying all like these past couple of days. So that's the Tordays day Pointays. So if I can find it, I thought I had it here. Okay, I'll just talk about it anyways. So with that, Tordays day Pointays, it's mostly caused because of certain medications, such as what I mentioned before, macrolides, methadone. Certain medications will cause that. So when that happens, it could be caused because of low potassium and especially low magnesium. When that occurs, you must give magnesium sulfate, which is another short I'm going to talk about as well, because that's very important. So please be cognizant of that as well. Administer the magnesium sulfate. And that should be it for cardiac arrhythmias. So hopefully that helps you. Again, I'm going to leave the sources like Simple Nursing and Registered Nursing RN. They do excellent videos on that. I'm also, and Level Up RN actually does a pretty good job as well. I actually learned a lot from her when I was studying, or from that, rather, when I was studying. And then I'm going to leave like an image. I could have sworn I had another lecture. I don't know what happened to it, but it's what it is. But check them out. If you didn't get much from me, I hope you did. Then, like I said, you can check those links. And then I also know Mark K does go over that, but you'd have to get the bundle, because I don't think he has any audio lectures of the cardiac arrhythmias. He might. I don't think he does. So with that said, I'll leave the link to Your Nursing Space, and I'll have all the bundles you need. And I'm telling you, I swear by it, because that's how I got the Mark K visual lectures. And not only that, you also have UWorld study notes, and study notes that are going to help you for the NCLEX and even nursing school. So why not check it out? And even Your Nursing videos has some good NCLEX prep questions. So I mean, because why, like, you want to pass, right? You want to be a PN and RN, like, check them out. It doesn't hurt. And I know the bundles aren't that expensive. It's only like 60 something, $70. I don't know. Anyways, thanks for listening, and I will talk to you guys another time.